Eliza had entered prison years ago, terrified and alone, but she had managed to find some stability during her time behind bars. The routine of prison life, while harsh, gave her a sense of control. More importantly, she had access to regular mental health care and ongoing prescription for medication that she relied on to manage her anxiety and depression. Those small pills, though inadequate, were the lifeline that helped her keep her mind grounded. But when Eliza was released, everything changed. Upon her release, the world outside felt like a bewildering, fast-moving blur. She was given a small packet of discharge papers, including a list of resources she should contact for follow-up healthcare, and sent on her way. But things weren't as simple as they seemed. She had no transportation, no money, and fewer connections than she'd hoped. The system she had relied on inside the one that provided her with mental health counseling and prescriptions had severed. The paperwork for Medicaid re-enrollment was overwhelming, but even that wasn't the problem. Eliza, who relied on mental health medication in prison, was released with little support. Unable to access health care, she turned to drugs to cope with her anxiety and depression, ultimately leading to her overdose. Eliza's story highlights the tragic consequences of inadequate health care for those released from prison. Each barrier to health care, particularly the mental health medications that she so desperately needed, edged her closer to a precipice of disaster. The self-medication with street drugs that once provided solace became a perilous crutch, and soon Eliza found herself trapped in a cycle of dependence and despair. One rainy evening, as she wandered the dimly lit streets in search of her next fix, she took a dose that proved to be her last. The drugs overwhelmed her, and in that moment, the struggle to survive ended in a tragic. Eliza had found a fragile stability behind bars, where daily mental health care and a small prescription provided her a lifeline amid the harsh routine of prison life. But when she was released, that support vanished. With only a packet of discharge papers and a list of resources she couldn't access, no transportation, money, or timely appointments, her vital medication was suddenly out of reach. Overwhelmed by untreated anxiety and depression, Eliza turned to street drugs for the brief escape they promised. What began as a temporary reprieve soon spiraled into a dangerous dependence, and one fateful night, a toxic mix proved too much. Eliza's tragic overdose is a stark reminder of the fatal consequences when critical support systems fail those transitioning back into society. In recent decades, the issue of healthcare for incarcerated women has emerged as a critical area of concern. Although prisons and jails strive to provide essential medical services, significant gaps remain, especially during the transition back into society. Women behind bars face unique and complex health challenges that differ significantly from those encountered by their male counterparts, and these differences are compounded by a rapid increase in the female prison population. The growth in the number of incarcerated women is not merely a reflection of rising crime rates. It is deeply intertwined with broader systemic issues. Harsh drug policies and mandatory minimum sentencing, particularly during the height of the war on drugs, have disproportionately affected women, often resulting in lengthy sentences for minor drug offenses. Socioeconomic vulnerabilities, such as poverty, limited educational and employment opportunities, and histories of trauma and abuse, further increase their risk of entering the criminal justice system. Additionally, the lack of gender-responsive diversion programs and support services has left many women without viable alternatives to incarceration, while shifts in law enforcement practices have broadened the definitions of criminal activity and increased the scrutiny of minor offenses. Incarcerated women also experience markedly different challenges than men. They are more likely to have histories of physical or sexual abuse, leading to higher rates of mental health issues such as depression, anxiety, and PTSD, as well as substance abuse disorders. Their healthcare needs include specialized services for reproductive and maternal health, such as prenatal care, gynecological services, and family planning, which are generally absent in male facilities. Furthermore, women often receive shorter sentences for nonviolent offenses and, before incarceration, are frequently primary caregivers, which adds emotional and social complexity to their reentry process. Within correctional facilities, efforts to address these complex needs include providing mental health counseling, substance abuse treatment, and management of chronic conditions like diabetes and hypertension. However, the quality and consistency of these services are often limited by budget constraints, outdated infrastructure, and staffing shortages. As a result, the healthcare provided is frequently a patchwork of services that struggle to meet the full spectrum of these women's needs. The challenges do not end upon release. The reentry period poses a critical gap in care as the structured environment of prison healthcare is abruptly replaced by the fragmented nature of community-based services. Many formerly incarcerated women encounter significant barriers in re-enrolling in Medicaid or securing alternative health insurance, leading to delays in receiving necessary care. The transition from a highly regimented correctional system to decentralized community care often results in missed follow-up appointments and medication lapses, further compromising their health. Without coordinated transitional programs that bridge the gap between incarceration and community health care, these disruptions can lead to worsening chronic conditions, relapse in mental health or substance abuse issues, and ultimately higher rates of recidivism. Addressing these challenges requires a comprehensive, multifaceted approach. Policy reforms are needed to streamline Medicaid re-enrollment and ensure continuous coverage, while increased funding for both correctional healthcare and community-based transitional programs can help bridge the gap. Establishing robust community partnerships and developing specialized reentry clinics can facilitate a smoother transition, providing tailored support that addresses both medical and social needs. Training correctional staff in gender-responsive, trauma-informed care is also essential for improving the quality of services offered. Ultimately, ensuring continuous health care for incarcerated women and supporting their successful reentry into society is not only a matter of individual well-being, but also a critical public health issue. By fostering a more equitable and coordinated healthcare system, we can break the cycle of instability and recidivism, promoting better outcomes for individuals and healthier communities overall. The challenges women face during incarceration and reentry are profound, affecting not only their immediate health, but also their long-term well-being and successful reintegration into society. The gap in healthcare and reentry support is a critical issue that continues to leave many women without the care and resources they need to thrive beyond the prison walls. At Swap Behind Bars, we are committed to breaking the cycle of instability by providing tailored reentry programming that offers comprehensive support, from mental health care and job training to housing assistance and community reintegration. Your donation is more than just a gift. It's an investment in hope, resilience, and lasting change. By contributing to Swap Behind Bars, you empower women to rebuild their lives and create a future marked by opportunity and dignity. Join us in transforming lives and strengthening our communities. Donate today and be the change that paves the way for a brighter tomorrow.